Okay, hello everybody. So this is the video lecture that's going to replace the lecture that was supposed to occur today, but of course we have a crazy snowstorm going on outside right now. And it's unfortunate that actually this day landed on the flexibility and agility lecture because I think it's a little bit easier to do in person, showing you some visuals. So please, by all means, ask me if you have any questions next class, and maybe I can go over some of the concepts that are a little bit easier to understand in person. So we're talking about flexibility and agility, and this is one of those lectures that I think when students first hear about it, they're like, wow, this is going to be boring. But actually, I think you'll be surprised how interesting it can be from not only a physiology and mechanistic perspective, but also from an applied perspective, because these variables actually have a lot of meaning in sport and athletic performance, and they have a lot of meaning in certain therapeutic modalities like those that are frequently practiced by physical therapists. So for those of you going on to physical therapy, I hope today will be an introduction to some of the concepts that you're going to explore in greater depth once you get into PT school. So in order to understand this topic, we first need to think about neural reflexes. And so we've talked a little bit about neural physiology in the past, but we really haven't had this idea of different levels of organization of the neural pathways. So, of course, our general understanding here is that there's a sensory receptor that is activated. So, we have sensory receptors all over the body in a variety of different tissue types. So, something is indicating that there's a change being made. So, this signal then gets transferred as an action potential through afferent neurons, which are then going to reach the central nervous system. And of course, the central nervous system is going to be not only the spinal cord, but the brain as well. And so we're going to see that depending on the exact movement or the reflex, there's going to be different levels of information that's coming to these regions. So especially when we're thinking about a reflex, most of this information is really going to be to the spinal cord, and the spinal cord is going to initiate a response that's appropriate for what it's encountering. Now, eventually this information will reach the brain so the brain knows what's going on, but we're going to see that with reflexes, the brain really doesn't have to get involved in order to elicit a response. It's made aware of the information, but it's not something that we think about. It's just a reflex. So from the spinal cord, there's another action potential that gets sent through efferent neurons, which are then going to reach the target tissue. Okay, so that's really what we're going to be focusing on throughout most of today, and we're going to see that not only does this topic pertain to flexibility, but it also will have a role in agility as well. Okay, so one thing we need to make clear, and just so that when you go on from this class, you have a good understanding of what types of information is occurring at the level of the skeletal muscle, because there are excitatory motor neurons, meaning that they're going to elicit some response, and there are inhibitory motor neurons. However, there are not inhibitory motor neurons at the neuromuscular junction. Okay, so there's no direct innervation of inhibitory motor neurons at the level of the skeletal muscle. We do have inhibitory motor neurons in the peripheral nervous system. They are interneurons. So recall that essentially this pathway is created by synapses from neuron to neuron to neuron to neuron in certain regions of the body, so especially in the brain and also the spinal cord. So there are these neurons that are sort of linking other neurons that are inhibitory in nature. So I just want to kind of throw out that idea now. We're going to see that again in upcoming slides. Oh, sorry, and I just wanted to illustrate too. So this really what gets us to our all or none principle. So remember, when we're innervating skeletal muscles, if there's an action potential, there's no turning back. Your muscle is going to contract. Okay, so that's another example of how we don't have inhibitory motor neurons. So there's no additional off switch if we need to. If you can hear my dog snoring in the background, I'm sorry. There's nothing I can do about that. Iggy, stop snoring. Okay, so there are specialized tissues throughout the body, a lot of times in joint locations, called proprioceptors. So proprioceptors are able to sense where our body is in space. It's really our sense of position. This allows us to walk in complete darkness without losing any balance. So there's a very similar term called kinesthesia. So proprioception and kinesthesia are very much related. There are some that will differentiate kinesthesia from proprioception by excluding the sense of equilibrium or balance from kinesthesia. So there are some very small differences there. For the purposes of this class, we're going to use these terms interchangeably. We're not going to get too detailed here. Okay, so in terms of proprioceptors, most of these are found, like I said, in locations of joints. So these include free nerve endings. These are found in joint capsules and connective tissue. So the joint capsule is really sort of a structure that encapsulates the joint. So remember, there's connective tissue all over the skeletal muscle system, and we're going to see some examples of that coming up. So there are free nerve endings within that connective tissue as well. So they are activated by extreme mechanical or chemical irritation. So really these free nerve endings, they're sort of unspecialized fibers that bring sensory information to the central nervous system. Many of them are what we call nociceptors, otherwise known as pain sensors. Now there's also Ruffini endings. These are found in the joint capsule. They're activated by stretching and tactile stimulation. So really, a sense of feeling, of touch. They signal the speed of movement. We're not going to talk too much about Ruffini endings, and really this is just my way to introduce you to a bunch of different receptors that we have that will help us with movement patterns. There's also paciniform endings. These are in the periosteum, which is really that outermost layer of the bone. So these are near articular attachments. They're activated by vibration. And then we also have Golgi type endings, and we will be talking quite a bit about these today. So these are found in ligaments. We're going to see that these are primarily located in the tendons. So of course this is connecting muscle to bone, and they are physically deformed. So they are mechanically manipulated when a ligament is stretched. So we're going to continue to talk about Golgi tendon organs in upcoming slides. Okay, so here's where we see the Golgi tendon organ. Like I mentioned, they're really found in the junction of the tendon and the muscle fibers. They respond primarily to muscle tension. Okay, so tension is derived when a muscle is contracting very strongly, so there will be tension that develops in this tissue, and that's what the Golgi tendon organs are going to pay attention to. They wind up causing relaxation, as we're going to see, and so this is really a protective mechanism. So that's what we're seeing here. If there's a lot of tension that develops, I'm looking at the top figure here, there's a lot of tension that develops in this bone, tendon, muscle relationship here. There will be a signal sent from the Golgi tendon organs, which are basically just fibers that are strung throughout this connective tissue. It'll get sent back to the central nervous system just to the level of the spinal cord. So this is a reflex arc. A signal will get sent from the spinal cord back to the muscle, and it will tell that muscle to relax. Okay, so if there's too much tension, this is protective, because if tension increases, this could result in the muscle pulling away from the tendon or the tendon pulling away from the bone. Generally, a lot of different options for tissue tearing. So if the system causes a forced relaxation, this reduces tension, it reduces the risk of damaging this tissue. Okay, so that's what we see here, detects tension. And one way that this is easy to remember is Golgi tendon. There's a T in tendon, so tension and tendon. Okay, so we mentioned before that there are only excitatory motor neurons at the level of the skeletal muscle. So this is one case where we're going to see that it actually elicits an inhibitory response. So it excites inhibitory interneurons in the spinal cord. So there are, and I'll show you another picture of this later on, but there are these interneurons. There are neurons that connect one another. And so those can be inhibitory in nature. So those will be excited, which then really prevents a contraction and elicits the relaxation. Now, another really important tissue that's going to be protective in nature are the muscle spindles. So muscle spindles are fibers that are actually made up of contractile fibers that are found in the belly of the muscle, meaning the very center of the muscle. So they're sort of packaged inside the belly of the muscle, and they do have these contractile properties. So this is kind of interesting because they have their own intervention from very specific neurons. They have sensory nerve endings that are interwoven throughout them so that they can sense stretch, and that's what we're going to see this tissue primarily is responsible for. So it detects changes in muscle length, or we can think stretch. Okay, so stretch, spindles, so we have two S's. So this is one way you can remember that Golgi tendon organs respond to tension, muscle spindles respond to stretch. So it's really the rate of change of muscle length is what these will pay attention to. Okay, so another thing they're responsible for is tonicity during relaxation. So they are actually going to elicit a very minor contraction in the skeletal muscle during relaxation to maintain tension. Okay, so if you can imagine a rubber band, and if you push your hands together so that that rubber band has a lot of slack in it, this is what you would not want in your muscle at rest, because the second you need to go to use that muscle, especially if you need to use it quickly, if you're quickly pulling on that tissue, there's a lot of potential damage that can be done if you take that material from a very relaxed too relaxed state to all of a sudden stretching it very quickly. So the muscle spindles will actually cause a very minor amount of tension even during relaxation. So if you could imagine, again, taking that rubber band, pushing your hands together, but then the rubber band would have some contractile proteins and it would actually take away a lot of the slack in that tissue. This is a better point to start from if you were to all of a sudden need to contract that muscle. So if you all of a sudden need to start running from something, it's very protective in nature. So it really accounts for tonicity during relaxation. Now, the thing that we normally talk about the most with the muscle spindles, though, is this reflex during an extreme stretch. So this is also known as the myotatic reflex or the stretch reflex. Okay, so what this would look like, and it's also sometimes called the monosynaptic stretch reflex, so lots of different names. Always great when they do that to us. Okay, so one of the best examples would be to think about if you go to the doctor and they use that little instrument to hit your patellar tendon. So if they hit that patellar tendon, that actually is going to create a very small but noticeable increase in the rate of stretch in the quadriceps. So I know you can't see my pointer right now, maybe a little bit. But there's, you see the muscle spindle in the quadriceps. So it will, if you hit the patellar tendon, it will cause a quick and very minor but meaningful stretch in the muscle spindle. So the muscle spindles detect the rate of change in the muscle length. It sends an afferent neuron to the spinal cord. And you can see at this point, this information is going to go to a couple locations. This will get sent to the brain, but the brain is not going to be involved in the decision making or the resulting effect. So it's just informed that that's what's happening. And then the rest of the signals are going to come back to the tissue. One signal is going to come back to the quadriceps. And you can see this is going to cause a contraction of the quadriceps muscle. And the other information is actually going to excite an inhibitory interneuron. Okay, so now we have an inhibition that's getting sent to the hamstrings. So the end result is that the quads contract, the hamstrings relax. Now this is a good thing, because if you have opposing muscle groups or antagonist muscle groups, like we see here with the quads and the hamstrings, that contract at the same time, not only does this make for an inefficient movement, but it could also cause some damage to one of the tissues, and most notably the hamstrings in this case, because if the leg kicks out and the quadriceps are contract, if the hamstrings contract as well, this could actually put a lot of tension, a lot of stretch, a lot of strain, if you will, on the hamstrings. So if they relax, they're sort of protected from any potential damage that might ensue. Okay, so essentially what we're seeing here, just to reiterate, we have the stimulus, in this case, the hitting of the patellar tendon. The muscle spindle senses the stretch, it fires. It then sends an afferent path, an action potential, that travels through the sensory neuron. The sensory neuron synapses in the spinal cord. One path is efferent. It's a somatic neuron to the quads. The second path, also efferent, has inhibition of the interneuron, and that results in hamstring relaxation. Okay, so this is another name for what we call reciprocal inhibition. So this is actually trainable, and this is something that people, definitely you can see this in individuals, and we've talked about this idea of coordinated muscle movements in the past. So if you have someone who's never played basketball before and really isn't very athletic, if you watch them, they look very rigid. So this is something, this reciprocal inhibition or this monosynaptic stretch reflex is something that they haven't trained very well. Okay, so this is trainable. As we'll see, I have an example coming up. Okay, so with this reciprocal inhibition, I have written out here just for your notes everything that we talked about in the last slide through the figure. So muscles on one side of the joint relax, that's the extensor, to accommodate the contraction on the other side. So I'm going to skip through this. This is really just for your notes. But coming back to this idea of reciprocal inhibition that can make a more coordinated, less rigid movement. So this is an example of how you can train this, or one piece of evidence that this is something that can be trained over time. So in this particular study, they looked at a very isolated section of muscle and nerves looking around the ankle and the foot. So plantar flexion is if you were to do like a ballerina thing with your toes and point your toes down to the floor so your ankle gets extended and your toe gets pointed down towards the floor. I hope I didn't just cause you a muscle cramp in your foot because that always is annoying. But that's the exact movement that would be a plantar flexion. So in this particular study, they did stretch training using plantar flexion to increase reciprocal inhibition measured during voluntary dorsiflexion. So dorsiflexion is going in the other direction if you were to point your toes to the sky. And so what they eventually saw here was that with this very specific stretch training around this particular joint, over time, the individuals were actually able to better relax the antagonist muscle group and contract the agonist group. Okay, so this can be trained. Now, another thing to consider with reciprocal inhibition and really coordinating movements of flexors and extensions is seen in other examples. So in this particular example, if you were to touch a hot object, you would have pain receptors. These are those nociceptors, which are free nerve endings in the skin. This information gets sent back to the spinal cord, and just like we saw before, one section contracts, and this picture doesn't really show it, but you will have the interneuron that winds up going to the other muscle group, and it'll relax. Whoops. Okay. Now, one thing that we need to consider is that that's not the only adjustment that needs to be made when you touch something painful. So in this example, now they're stepping on a tack. So we have this information that goes back to the spinal cord, and not only does it need to get sent back to the leg that stepped on the tack, as we've kind of seen in the past, where the agonist muscle group contracts, the antagonist muscle group relaxes, this information also needs to get sent to other locations. And so in this particular example, it needs to get sent to the other leg because it needs to make postural adjustments. So not only do you have to remove your foot from the tack, you also have to prepare the rest of your body to not fall over in the meantime. So this reflex is also going to branch out and address those issues as well. So it will shift the center of gravity. Simultaneously, it will withdraw the reflex or the foot from the painful stimulus. So aside from reciprocal inhibition, so where the reciprocating muscle group or the antagonist muscle group relaxes and the agonist muscle group contracts, there's another really important concept using these same structures we've been discussing called autogenic inhibition. So this is sometimes called the inverse myotatic reflex, and this is more focused on the Golgi tendon organ. So the reciprocal inhibition was really focusing on the muscle spindles. Autogenic inhibition really focuses on the Golgi tendon organs. So in this case, the Golgi tendon organs increase the inhibitory input to relax the contracting muscle under high tension. So with reciprocal inhibition, we saw an inhibition of the non-contracting muscle, so the antagonist muscle group. So in this case, now we're focusing on relaxing the agonist or contracting muscle group. And this is under circumstances of really high tension. So this is protective in nature. It prevents the muscles from exerting more force than the bones and the tendons can tolerate. So if you're trying to produce so much force and there's so much tension being developed in these tissues, theoretically, your muscle is capable of producing enough force where you could rip the muscle away from the tendon, or you could rip the tendon away from the bone, or both. So you have to have some sort of mechanism in order to prevent that from happening. And here we have autogenic inhibition. So as an example, if you were to lift this pile of bricks, your biceps femoris will contract in order to facilitate that movement. The Golgi tendon organs will sense that, and you see that there's a stretch in the Golgi tendon organ. So they're really feeling the tension, however. So this is kind of a love-hate relationship with this figure, because remember, you should be thinking Golgi tendon organs feeling tension, whereas muscle spindles really focus on rate of stretch. Okay. So we sense this in the Golgi tendon organs, and if this is too much weight to overcome, the Golgi tendon will actually cause a relaxation of the muscle group that had been working to hold up those bricks. So this will be a reflex arc that gets sent to the spinal cord. An inhibitory signal will get sent back by activating that inhibitory interneuron. This will cause relaxation, and then you will drop the bricks. Okay, so this is very protective in nature. And we'll also see that this comes into play when we talk about different stretching techniques. Okay, so we're going to talk again about autogenic inhibition, especially when we're talking about static stretching. So I want to plant that in your head now so that when we come to it, it's fairly familiar. Okay, so control of movement can be really, really complicated, and motor control is a discipline in and of itself. So we're really only going to touch the basis here, but I wanted to make sure that we're understanding that there's like a hierarchy of movement control. So what we've been talking about so far is really on the bottom of the hierarchy. This is where there's information that's integrated at this level of the spinal cord only, and it causes some sort of reflex movement. Okay, so there's not a whole lot of brain power that goes into this. Now, as the movements start to get a little more complex, we have to start involving the brain. So you can see the brainstem and the cerebellum will control postural reflexes and hand-eye movements. So these are a little bit more complex in nature. And the most complex movements, which are voluntary in nature, are going to rely on the cerebral cortex and the basal ganglia in order to perform those tasks. Okay, so reflexes are the most basic examples, but very complex voluntary movements will require greater hierarchy. And that's what we see here as just some example movements. So the reflex movements are least complex. They're integrated at the spinal cord. Postural movements, as we mentioned, go a little bit farther up in this hierarchy. The voluntary movements are the most complex. They require integration at the cerebral cortex. And then this last category here with the rhythmic movements is really interesting because it's a combination of several. So this is sort of reflex in nature, it's sort of voluntary in nature, and so it needs a lot of different innervation. So not only higher level thinking, so using the cerebral cortex, but also at the level of the spinal cord. So what do we mean by rhythmic movements? It's really involving a lot of different types of exercise. So whether this be jogging or swimming, these are voluntary, but also rhythmic, right? They follow a pattern. So in that sense, they're fairly not complex, but there are some complex movements involved. So those would be examples of rhythmic movements, or repetitive movements. Okay, so this really brings us to the concept of flexibility. This guy's pretty impressive. I know I'm very far away from being able to do that. And there are some people that are naturally better at flexibility than others, but this is also something that can be very trainable. So this really describes the amount of movement that's possible around a specific joint or series of articulations. So this is important to identify because you can be very flexible in one joint and not another. Okay, so it's very joint specific. So there are two different types. There are static and dynamic, and we've introduced these terms before, so you should already have an idea that static really is involving not a lot of external movement, where dynamic, there's a lot of movement throughout the range of motion. Okay, so that's what we see here, and we're going to throw in a couple more words to help describe these. So static, the degree at which a joint may be passively moved to the endpoints in the range of motion. So it is passive. The person is not doing a lot of movement throughout the range of motion. So the best example is if you're trying to stretch your hamstring, one thing you might do is sit on the ground and reach out to touch your toe. Okay, so when you're doing that stretch, it's static because you are really finding one point in the range of motion and you're staying there. So this is kind of one that can be tricky because there are, as we'll see, complexities even within these categories where you can have some static movements that are more active, but most of the time these are passive. So most of the time it's not really requiring a lot of energy because you're just holding one position. So this really kind of brings up some interesting topics of injury prevention and decrease in muscle soreness. So there used to be a widely, at least repeated, idea that static stretching decreases your risk of injury. However, there is absolutely no literature to support that. Nobody's found that yet, and everybody's definitely diverged from even making that statement. So there's no reason to believe that if you stretch before an event that prevents injury. Okay? However, we're going to see that there are other types of warm-ups that prevent injury. So there's also a notion for a while that static stretching decreased muscle soreness. Also not supported in the literature. There are people still looking into this, but it doesn't seem to really be a mechanism that would explain something like delayed onset muscle soreness. That seems to be much more involving inflammatory molecules more than how much stretching you did before that exercise bout. Okay, so with dynamic stretching or dynamic flexibility, this is the degree to which a joint can be moved as a result of a muscle contraction. Okay, so this is where I really wish that I had you in person here, because dynamic stretching, if you can imagine, and perhaps some of you who have played sports before have done these before, but if you can imagine holding on to something and swinging your leg in front of you and behind you in repetitions, and you're going through this whole range of motion, and especially at the ends of those range of motion, you are stretching this tissue. So this is active in nature. You're essentially swinging your leg back and forth. So this would be one example of a dynamic stretch. Okay, you're definitely reaching the ends of the range of movement, and you're pushing that limit, but you're not holding any position in order to stretch that tissue. So this is definitely taken over as the primary method for most athletes to warm up. It kind of kills two birds with one stone. It does work on range of motion and increasing range of motion by pushing the limits of those range of motion, like swinging your leg back and forth. And it also increases muscle activity, which is a warm-up. Okay, so if you can move your muscles where you are getting more blood flow to the muscles, where you are starting up your metabolism, you're increasing muscle temperature, these are the sorts of things that are thought to be related to injury prevention. Okay, as opposed to static stretching. Now, will you have some of those effects with static stretching? Yeah, you will increase some blood flow. You will not, however, have the extent of blood flow or the extent of muscle temperature increases that you would with dynamic stretching. So that's why this is very much recommended for athletes. Now, the other funny thing with static stretching is that, and there's a lot of evidence to support this now, this is really not questioned anymore. Static stretching results in decreased power output for about 20 minutes. So if you were to do that hamstring stretch and you were to stretch your quads in a very traditional sense where you hold one position at the end of the range of motion for, let's say, 20, 30 seconds, and then you try to do a maximal vertical jump, you will actually not be able to jump as high as you did before that stretch. So this is, again, not questioned anymore. And it's actually very funny that you'll still see even professional athletes do this. And people complain about this all the time in this field, that we're telling them we have evidence, don't stretch before like a basketball game like that, do dynamic stretching, not static stretching, and people will still do it. It's incredible. But again, that effect normally goes away at about 20 minutes. There's individual variation, but it is short lasting. Okay, so one other thing I want to point out under dynamic stretching, it says increased range of motion in sport performance. And so this is something I want you to start thinking about. We'll keep talking about that. Those people that are professional athletes are very good at, a particular sport. One thing that people tend to note with these individuals is that they have high range of motion surrounding certain joints. So if you have increased range of motion, this allows for increased torque, which normally allows for improved performance. So if you think about if you're trying to throw a javelin, or a baseball. If you have a bigger windup, let's say, meaning you have a bigger range of motion surrounding that joint, you will be able to perform better. You'll be able to throw that javelin farther, you'll be able to throw the baseball farther, faster, etc. So there is a relationship with increased range of motion and improved sport performance. And so, I mean, really start thinking about what sports would benefit from flexibility or increased range of motion. And I think you'd be hard pressed to find one that doesn't really rely on it. So the obvious ones, wrestling, mixed martial arts, gymnastics, track and field, but really everything. I know as a volleyball player, this was something that was highly beneficial. If you had increased range of motion in your shoulder, you tended to be a better hitter. However, there are, of course, abnormalities in flexibility. So, surrounding typical joint movement, if you have a pathological loss of range of motion, a range of movement, this is called ankylosis. So, for example, if you were to greatly injure yourself and perhaps you even had some tissue replacement in that area, like lots of fibrotic tissue, really a more stiff joint, this can reduce your range of motion. And so quite honestly, this is what a lot of physical therapy is dealing with, is ankylosis, this pathological loss of range of motion due to some sort of injury or surgery or both. And so a lot of different practices are surrounding trying to increase range of motion or decrease ankylosis. Now, you can also have hypermobility and excessive range of motion. And so this is what a lot of times athletes will actually either be born with or will develop over time, is a really great range of motion surrounding a joint. And so this is excellent for sport performance, but it definitely puts people at risk for injury. I can speak from this firsthand. So I had great flexibility in my shoulder, and I had numerous shoulder problems throughout volleyball. So this is, I mean, if you talk to anybody in the throwing sports, if they, were fairly successful, they tended to have a greater range of motion than some of their counterparts. However, injury rates are normally pretty high. Another thing that's kind of interesting is you can have high flexibility in one joint and have low flexibility in another. So even if you're super flexible in your shoulders and you have great range of motion there, you might have super tight hamstrings. And that's probably something that you're well aware of. But another thing that's actually really interesting is that even at the same joint on different sides of your body can have different range of motion, which is also pretty interesting. Now, this is sort of a blanket statement. Of course, this doesn't hold true for everybody, but females do tend to be more flexible than males. Again, not always, but that tends to be the trend. Now, why this is, lots of different theories floating around out there, and this kind of gets to the topic of ACL injuries, or anterior collateral ligament injuries. So one of the primary ligaments that stabilizes the knee. Injuries of the ACL tend to be a lot more common in females than men. And so people have looked to, how is this explained? And one option is greater flexibility or greater extensibility of the ligaments. They tend to be a little bit more flexible. So this might put them at greater risk of damaging the ACL. Now, why that is, some people point to the sex hormones like estrogen and progestin. They do increase ligament flexibility, especially for purposes of labor and delivery. But it, of course, those hormones do cycle up and down throughout the month. And so some people have looked to that. However, there's been numerous studies where that actually didn't pan out. So they've looked for other types of examples. So going back to ACL, some people suggest it might be muscle imbalances where they might not have the degree of musculature and therefore strength that's stabilizing the knee as men do. And another option actually comes back down to the hips. So if you remember from last class when we were talking about squatting and I said, women, make sure that you don't point your knees in as you're going down into the squat, and that's really easy to do because of our hip angle. It just kind of points inwards like that. The same idea pertains to one of the explanations for high ACL injuries. So that angle, because the hips are out more, is called the Q angle. So especially women with high Q angles, they're thought to have greater instability of the knees because of that angle. Okay, so a little bit of a tangent there, but going back to the idea that this flexibility issue might explain greater injury in women than men. Okay, so definitely thinking again about physical therapy or athletic training, there are certain tissues that are targeted in order to increase range of motion. So, especially with the muscles, we think about tendons and connective tissue sheaths. So, if you remember, and I'm going to point you down towards the bottom of this slide now, looking at gross anatomy of skeletal muscle, remember that there's lots of connective tissue here. So, not only do we have the tendons, which are, of course, connecting the bones and the muscles, but there's the endomysium, the paramysium, the epimysium that are surrounding the different components of the muscle. So this is all connective tissue. The epimysium is surrounding the whole muscle. The endomysium is between the fibers, as you can see, and then the paramysium is wrapping around the fascicles. So these are all connective tissues that can be targeted to increase range of motion. Now, another thing that can be targeted is the joint capsule, and that's what you see on the right side down at the bottom. So you see there's this fibrous capsule around the outside of the joint that is sort of containing the joint. It's containing the synovial membrane. It's containing the head of the bones here, as you can see, the cartilage. So this fibrous capsule can also be targeted in order to increase range of motion. Okay, so just a little note here to make sure we're all clear. This is important for athletes and rehabilitation stretching. Connective tissue is the most important thing to focus on in terms of increasing flexibility. Okay, so just to make this very, very clear, here we are again. Target tissues, connective tissue, tendons, ligaments, joint capsules, aponeuroses, fascial sheaths. So all of these different connective tissues that are spread throughout every joint. So another thing that's important, and I kind of hinted at this when we talked about injury prevention, is the temperature of the tissue. So it's very important to increase the temperature of the skeletal muscle and the surrounding tissue when you are looking to increase flexibility. So the optimal is 40 degrees Celsius, which is about 104 degrees Fahrenheit for maximum connective tissue relaxation. So we're focusing on the collagen. Remember, collagen is going to be a big component of connective tissue. So in order to relax that collagen, it needs to be warm. And so people have done studies to find the optimal, and they find 40 degrees Celsius. So for those of you who have ever done physical therapy before, or for those of you going into that career path and you've done some job shedding, you've probably noticed that one of the first things they do when you walk in is they give you a heat pack. So if you, depending on what joint is, really the culprit of the issues, they give you a heat pack. You put that heat pack on that joint for about, 15 minutes is normally fairly standard in order to increase the temperature of the tissue. So it's nice and ready for manipulating that connective tissue. Now, we also mentioned that blood saturation is also very important. So this is helpful for muscle elasticity. And really, there's a couple things involved. Of course, it's best to deliver nutrients and have an option for removing waste products as soon as you are doing any sort of manipulation of tissues. But another thing that the blood is going to do, increasing blood to an area, is going to increase its temperature. Okay, so that's sort of a multifaceted benefit. So vice versa, if you increase the temperature of the tissue, this is also going to stimulate blood flow. So that's another nice thing with the heat packs, is that not only is it warming this tissue to make it very pliable, but it's also increasing blood to that area, because as soon as you apply heat, your vessels are going to dilate, so more blood flow. So in order to really change range of motion around a joint long term, you need some sort of deformation of the tissue. So it's a plastic deformation, which basically means that there is a change in its shape or structure. So this is something that can be done with repetition and with progression. You can change this tissue long term. Okay, so those of you going into physical therapy, of course, that's one of the primary principles is people come back regularly for, depending on how severe, so many visits. The tissue is stretched. They're also sent home with additional, exercises to stretch that tissue and or strengthen the surrounding musculature. And so this tissue is repetitively deformed to make some sort of plastic deformation, meaning a sort of a permanent deformation in order to improve flexibility. Now, of course, one issue here is that you always have to keep in mind that if you elongate the connective tissue, there's some degree of mechanical weakening that takes place. So the amount of weakening is going to depend on the way that the tissue is stretched and how much it is stretched. So if you have a really high force stretching, this is going to produce more structural weakening. Low intensity stretching minimizes deterioration of tensile strength. So tensile strength is really the amount of force necessary to pull something like a rope, a cord, a wire, some sort of structural beam in order to break it. Okay, so obviously, no matter what the tissue is, if you pull it so much, you do run the risk of high tensile strength, meaning you could actually break that tissue. Now, this is sort of a balance because we know that low intensity means, less opportunity to damage that tissue, high intensity, more damage, but you really want to push the boundary here because we're trying to make a plastic deformation. So you have to remember it's the specific adaptation to impose demands. If you impose a lot of demand on that tissue, you will get the adaptation you're looking for. So it's this fine balance of pushing this tissue while also paying attention to how that person's feeling or how you are feeling if you're the one doing the stretch, and really listening to your body and knowing when it's time to back off a little bit. Now, in terms of neuromuscular adaptations with stretching, most of this is going to come back down to the stretch reflex. So remember those Golgi tendon organs and the muscle spindles? Well, they have a working relationship. So you see that the Golgi tendon organs override the muscle spindles, and this is going to allow the muscle to reflexively relax. So what we're describing here is autogenic inhibition. Okay, so with autogenic inhibition, the Golgi tendon organs are going to say, okay, time to relax the muscle. This normally takes about 6 seconds, and you can actually see this in yourself. So if you were to do that same hamstring stretch we talked about before, you sit on the ground, you go out to touch your toes, you can only stretch so far at first. And if you hold it, and there's individual variation, but normally it's around like a few seconds. 6 seconds is what some of the literature says. If you hold it, all of a sudden, now you can go down further. And then if you hold that, you can go down further. Now, of course, there's an endpoint to this, but what you're experiencing every time you can then stretch further is autogenic inhibition. It is the relaxation that is put forth by the Golgi tendon organs. So these Golgi tendon organs are telling the muscle to relax. Okay, so then you can stretch further. Okay, so we talked about different stretching methods being static and dynamic. So in this case, with static, this maintained extension, so you're holding one particular range of motion, allows the muscle spindle to relax. Okay, so normally the muscle spindle is contracted because it feels this rate of stretch. It's protecting, so it contracts, and then it will actually relax a little bit over time. So the muscle spindle will relax because it's overridden by the Golgi tendon organ. And of course, there are some benefits to this. So the opposing muscle group will start to relax along the way. There's little perceived pain for the most part with static stretching as long as you do it carefully. And it can be performed by yourself, so you don't have to have somebody else involved. Now with dynamic stretching, this is repetitive contraction. So again, if you can kind of go back to that idea of swinging your leg back and forth. So in these movements, you have a really quick stretch at the end of the range of motion of the antagonist muscle. So think about your leg, you swing it out forward. What you wind up with at the end of the range of motion is a quick stretch in your hamstrings. Okay, so there's a few things going on here. We already talked about that this can be used as a warm-up, which is great because this is time efficient. It helps improve your range of motion, and it gets you ready for the event without, and reducing injury rates. Excuse me, I keep burping. So another benefit is that the movement can be very sport specific, and we're going to see some examples of this. But for example, if you perform the hurdles, you can make this dynamic stretching routine very specific to the hip, to the knee, and you can actually improve in your sport performance while also using this as a warm-up. Okay, so here's my example, and there is a YouTube video down here if you'd like to see this in action. But basically what this girl is going to do is keep putting her leg in front of the hurdle and in back of the hurdle. And so she is using the end of the range of motion in order to perform this. It's repetitive. She'll do this numerous times. And again, this is not only helping with improving her range of motion, but it's also warming up her muscles in order to prevent injury. Okay, so this is where we get into, I'm not going to spend too much time on this, but I just want to let you guys know that there are variations. So far I've really talked about static passive, where you for example, hold your ankle and you can just basically sit there passively and stretch your hamstrings. But there are some static active techniques. So you can see it's the ability to assume and maintain extended positions using only tension of the agonists and stabilizers while the antagonists are being stretched. So for example, if you were to lift your leg out in front of you and keep it there without support, that would be static because you're not moving throughout the whole range of motion, but it is active because you have to keep your leg up there. So you are actively keeping your leg up there. So this is definitely a more advanced technique. You don't start somebody out on this. I personally can't do that. Just hold my leg out at the very end of my range of motion. But especially considering athletes who've been doing this for a number of years, they are very capable. So of course, this is dependent upon a couple things: how statically passive your flexibility is. So, if you're very good at sitting on the floor and touching your toes and stretching that hamstring, you tend to be better at something like static active. And how much muscular, somebody's calling me, how much muscle you have surrounding these joints in order to stabilize your position, of course, is another issue here. So you have to be strong enough to hold that position. Okay, so this is something that is particularly critical for those of you going on to physical therapy, and you're going to use this a lot. So PNF, or proprioceptive neuromuscular facilitation, is commonly used in physical therapy practices. And so it's an advanced method of flexibility training, typically used in a clinical setting. It's active in nature, and this is something that people can't do by themselves. So this requires a physical therapist or somebody who's qualified, and then the individual performing the task. So this is great because it does several different things all at once. It improves muscular compliance, so essentially the ability for that tissue to expand and be manipulated. It improves flexibility, so the range of motion surrounding a joint, and it strengthens the surrounding musculature around that joint. So it's really a great tool. It's normally something that comes after some initial physical therapy. It's a little bit more advanced. So essentially what it winds up looking at is a stretch that's immediately after a maximal contraction. So there are different types of this. We're not going to go into the details, but there's variations, one called contract relax, another that's contract relax with agonist contraction. So there are variations. And it really facilitates everything that we had talked about so far in terms of reciprocal and autogenic inhibition using the muscle spindles and the Golgi tendon organs, and really training this tissue to perform optimally while also strengthening the surrounding musculature and increasing range of motion. Okay, so I am going to attempt to play this video. I'm not sure how this is going to work out. Hopefully I didn't screw anything up already. Oops. Whoops, what am I doing? I just want to give you an idea of what this would look like. So this is primarily around multiple different joints, but either the upper limbs or the lower limbs, excuse me. So in this first one, you're going to see, this is of course using the upper limbs, and you're going to see that there's different patterns that they do. So you see this one's called D1 flexion. So she is going into flexion right now, and actually if I increase the volume, if I can figure that out, he's going to describe all the different movements that are happening throughout this range of motion. So now that was flexion, they're going to go back into extension of the shoulder joint.
Finger extension, wrist extension, ulnar deviation, pronation, internal rotation, abduction, extension, and posterior depression of the scapula.
Okay, so now they're going to do a different pattern. Instead of going out from the side and across the body, they're going to start across the body and come away from the body.
Medial deviation. I got elbow extension, abduction, and external rotation, and supination, and flexion of the shoulder.
Okay, so they're going to keep doing this. I'll let you watch the rest of the video by yourself if you're interested. Um, Also note that, let me just make sure this is still on. Okay. They will do that same sort of activity in the lower limbs as well. So they have that for the leg as well. So there will be D1, D2, flexion, extension of the lower limbs as well. Okay, so one thing that video didn't really show is how that would happen realistically. So he was just going through the patterns and saying all the different movements. Clearly, that was some sort of testing scenario. But if they were to do this in real life, this is a fluid movement, especially once they teach the patient how to do it properly, and they are moving throughout that range of motion very smoothly and continuously. So they'll go into flexion, extension. And at the end of the range of movement, so if you can imagine the very end of both of those patterns we just saw, he is actually going to wind up quickly stretching that joint just slightly past where the person had gone and quickly have them go in the opposite direction. All the while he's moving that person through these patterns, these movement patterns, he's applying some resistance so that this person has to push against his hand in order to go throughout the range of motion. Okay, so that's where the strength part comes in, is because that person has to produce enough force to overcome the person pushing back on them, the therapist pushing back. Okay, so they're going to push back throughout the range of motion. That's going to enhance muscle strength throughout that joint. And then at the very end of the range of movement, the therapist is going to stretch that movement a little bit, so it's going to push them just slightly past where they were taking themselves to, and that stretch is going to actually facilitate movement going the other direction. So it's going to push the limits of range of movement, and it's also like the stretch shortening cycle that we talked about before. So if you stretch that tissue really quickly, you will actually contract with greater strength going in the opposite direction. Okay, so that's my brief introduction to PNF. Of course, those of you that are going on into PT school, you will definitely learn more about that. Another thing that physical therapists use to their, sort of in their toolbox is joint mobilization, or joint mobs. These creep me out a little bit, but they're very effective. So this is passive in nature. It's an advanced technique to increase range of motion. They usually target the synovial joints. So again, I wish I had you guys in person to show you this, but you can see at the top picture, they're working at the shoulder joint. You can also use the elbow. You can do this even as small joints as finger joints. So looking at the shoulder joint, you can see that her torso is stable on that table. And you can't really see it here, but the table does fall enough right where her arm is so that there's really not a lot of support under her arm. And what he's doing carefully is actually pushing her shoulder downwards in repetitive bursts. So sort of like a rhythmic pattern of pushing her arm away from her shoulder. Now there's different levels of joint mobs. It's like 1 through 5, if I remember correctly. One of them, and I think it's 1s, are actually a little bit smaller movements. So it's really just minor pushes, where 5 is really pushing pretty hard, really moving the arm away from the shoulder joint. So joint mobilization, of course, is passive. It's a little bit more aggressive, but it's really pushing that connective tissue to its limits. It's really forcing the range of motion past what that person's capable of. So this is another way to increase range of motion surrounding a joint, or increase flexibility. Now, in terms of testing for flexibility, of course, there's a lot of different ways to do this, and some of them we're all very familiar with. So if you remember the President's Physical Fitness Test back in like elementary school, I guess that was, there was the sit and reach test. So this used a box, and it was really testing hamstring and lower back flexibility. Weirdly enough, they've kind of made the President's Physical Fitness Test a lot easier, especially since I was going to school. Like, we never had this option, but they now give people the option of just doing this with one leg in order to protect their back. It's kind of ridiculous, but anyways, this is one way you can test hamstring strength. So of course, the thing that she's touching, that box has a ruler on it so that you can measure how much she was able to extend this musculature. Now, this one is definitely a technique used for people that are more advanced. This is not something that the general population could use. This is very common in physical therapy, athletic training, other types of medicine. But in order to test the range of motion surrounding a particular joint, you can use a device called a goniometer. So you can use this for the shoulder, the hip, the knee, the ankle, I mean, you name it. And there are standards that are listed, so population references that say, this degree of range of motion surrounding this joint is considered normal. This would be pathological. Now, why this can really only be used with a professional is because they have to have a really good knowledge of anatomy in order to use this tool correctly. So the two arms that are extending from this goniometer need to be perfectly aligned with very specific anatomical structures. If they're not, you're going to get a misreading and obviously not effectively evaluating someone's flexibility. Okay, so that ends the flexibility discussion. We're going to move into agility, we'll see that there are some similarities in what we're about to describe. So agility is really describing the skills and abilities needed to explosively change movement, velocities, or modes. So explosively, you're trying to produce a lot of force quickly, so this is really thinking about power. Obviously, most sports use this. So if you think about any sport, whether it be soccer, volleyball, football, baseball, any of the martial arts, it's really, you're hard pressed to find one that doesn't rely on agility for, good performance. Okay, so the movements will include deceleration, so really slowing down, immediately followed by acceleration or speeding up, often in another direction. It doesn't have to be another direction. So if you are, running towards somebody and you have to quickly speed up, this is technically agility as well. So you could be going in the same direction, but you just have to explosively move forward. Now, I just want to note for anybody who's really into physics, technically deceleration, I guess, is not the right term. A lot of physicists get upset with you when you use deceleration. Apparently it's negative acceleration, but I'm not that particular. Okay, so agility in sports involve a lot of different things. So like we mentioned, every sport pretty much benefits from improved agility, but it might be a change of direction, it might be a change of speed, it might also be evasive and tracking maneuvers. So really paying attention to opponents, avoiding them, or moving in such a way that you can track them and or track the implement like the ball. So my question to you would be, what component should receive primary focus? And since I don't have you in the classroom, I hope you're kind of thinking about this right now, but really, it depends on what sport you're playing, what position you're playing, and or what you need to focus on in order to improve. Because perhaps you use all of these and you're really good at two of them, but you need some work on another. So this goes back to, what is the person's goal, right? There's not one size fits all. You really need to evaluate what that person's needs are. So in order to learn to become more agile, there are a few things that need to be focused on. The development of appropriate movement patterns. So, making sure that you are contracting the appropriate musculature. You are integrating locomotive skills efficiently. So we've talked a lot about now of coordination of muscle groups, and this does sometimes involve some of these reflexes that we've been talking about and really manipulating the Golgi tendon organs and the muscle spindles. So making a more smooth, non-rigid movement. And also proprioceptive or kinesthetic awareness. So being aware of what your body's doing. And this is something that people that have had recent surgeries, like knee surgeries and things like that, one of the things that they need to train again. So their body needs to become aware again of what that knee is doing, or whatever, the recent injury or surgery was. And this is why it's particularly challenging. I had a friend that actually had 2 ACLs, one in each knee. She had the surgery done at the same time. So she had 2 bunk knees, and they highly, stressed that wasn't a good idea because of proprioceptive awareness, that both knees being damaged like that and trying to re-strengthen, retraining these muscle groups is difficult if they don't have a healthy one to compare it to. She just wanted to get it over with, I guess. So it worked out, but I think it took her a little bit longer to recover than most. So in terms of the progression, just like we saw with strength training, complexity and specificity will increase as time goes on. So first you start off really slow, you start off very basic, and as the person progresses, you get more complex in the types of drills and you get more specific to their sport needs. So examples of how to get more complex and specific: changing the field conditions. Perhaps first you start this off on a court, but this is a soccer player, so then we add in the the field, which of course is more complex than a court because it has divots, it has, intricacies that are things that your body has to constantly adjust to. You might also include a partner. So not only do they have to pay attention to themselves, but they have to pay attention to their partner as well. Might implement an area or a time restriction. So perhaps, at first it doesn't matter how much space you use, but now I want you to do it in this much space. Or now you only have, so many seconds in order to complete this. You can make it faster and faster as the person gets better, and that's normally what you need to do in order to be more sports specific. Sports aren't slow for the most part. And then making them more open. So perhaps the person doesn't know what to expect anymore. You might actually, we'll see an example later on, in football where you don't know what direction the coach is going to throw the ball. So you have to pay attention and act accordingly. Okay, so keep in mind though, while this is really the end goal of getting really complex and sports specific, as soon as you add complexity and specificity, you are increasing the risk of injury. Now, this is one thing that we didn't get to talk too much about the other day with training for strength and power, but more complex movements like plyometrics, really like our jump training, or really big muscle groups should always come first. So, for example, if you're going to do box training, you always do that at the beginning, even before you start strength training, because you have a greater risk of injury in that particular exercise. Now with the muscle groups, it is recommended that you do your large muscle groups first. So multi-joint groups. So for example, the bench press, the back squat, the deadlift, all those things that we talked about, you would normally do before isolated muscle groups if that's what you were planning to do the rest of the day. So you would do those before you did bicep curls or before you do leg extensions. So complexity is definitely something you have to keep in mind with order of activities. Okay, so another thing with agility training is start young. This is a great thing to implement with children. It's fun. They love it. We'll see that there are a lot of different tools that you can use in order to improve agility that are also really fun. Eventually, you want to train at high speeds. That's really the goal in making it sport specific. And like we mentioned before, you put it towards the beginning of a training session in order to avoid injury. So in terms of the acute program variables, how do those fit into agility training? The volume, how you'd really measure volume is the distance covered, is one example there. In terms of frequency, you can implement it as a daily warm-up routine. So this can be used as a warm-up, so really making efficient practices. It is dependent upon intensity in terms of frequency. So if you had a really intense agility training, you don't want to do this, back to back in consecutive days. You might even only want to do 1 or 2 a week if it was really intense. In terms of the intensity, this is dependent upon velocity, angles, complexity. I'll show you some examples of those. And rest, there's no reason to do short rest between agility exercises. So long rest, you want to make sure that the person is fully recovered in order to not only make sure that they're giving their all-out effort to improve their skills, but also to avoid injury. Okay, so one thing I failed to say in the stretching lecture and the flexibility lecture, but I definitely want to mention it. Another issue is static stretching and why it makes a lot of sense to do dynamic stretching or even agility training for warm-ups. Static stretching, when done precisely and properly, takes forever. Okay, so if you are someone like a gymnast where really high flexibility is important, they will actually have static stretching routines that take hours. And we've actually calculated this before. If you were to do all the big muscle groups and you did 20-second holds, 3 repetitions for all those muscle groups, it would take you like 3 hours. So that's another thing with static stretching. It takes a long time. So that's another great role for implementing either agility training or dynamic flexibility as a warm-up because it saves time and it kills multiple birds with one stone. Okay, so here are some examples of some agility tests. This is called the Illinois agility test, and you see down at the bottom, this is the start. The person runs, and again, this is faster the better, but when they're learning it, they might do it slow first. So they run out 30 feet. They do a wide angle turn. So this is one area that you can change the complexity. So a sharper angled turn is more complex. So this is a wide angle turn. They come back, they do a figure 8, and you can see they end similarly to how they started. So there is a video down here if you'd like to see somebody perform this. So of course this would be timed. Another example is the 505 agility test. So in this case, you record the time from 5 meter marker back to the 5 meter marker. So you start in the very center here, as you can see. Oh, sorry, at the very edge. There's a start-stop light, and you come back, you turn, and you come back to the middle again. So this really has a sharper turn involved. So it's a 180-degree turn, and this is a slightly more complex angle than the previous example we saw in the Illinois agility test. Here's a zigzag test, and a lot of times this one is used as definitely a more advanced tool, because not only do you sprint out, but when you sprint back at this sharp angle, you're supposed to do it backwards. Okay, so now we're looking at sprinting forward, sprinting backwards using these sharp turns. Here's a lateral change of direction test. So in this case, you're supposed to face out in front of you, but you're moving left to right, and you're supposed to keep your body still faced front. So again, it's always important to think, what's the sport and why would you be implementing these? If they don't do this type of body movement, it really doesn't make sense to use this as a drill or a test. Okay, so in this case, and we've probably done this before, so this is also known as the shuttle, like a shuttle agility, I think it's called, like a shuttle test. So you start in the middle, you run out to the right, you come all the way back, you go to the left, and then you end in the middle. Okay, so the whole time you're facing ahead, even though you're running left and right. So it's really like a shuffle, kind of quick shuffle. Okay, so some of the tests, and I wanted to point out because the lateral change of direction test is one of them, will have normative data, meaning that there has been a lot of data collected on people of different age groups, men and women, and so you know how you compare to other people who have also done this test. So you can get percent rank in terms of deciles. So for example, if this took you, and of course shorter time the better, if this took you 3.37 seconds as a female, you're actually really good at this. You're probably a phenomenal athlete. You're in the top 10 percentile. Of course, you can compare back to yourself too. So you could do these sorts of tests before a training program, after a training program, and see improvements, see what's working. Now here's another variation, the hexagon test. So you start inside the hexagon and you jump out, jump back in, jump out, jump back in, jump out, jump back in, and go all the way around the hexagon. So you would go A, B, C, D, etc. So this is good because it's more of a jumping type strategy. It really focuses on proprioception. It focuses on balance as well as explosive quick movements. Here's the T-drill test. So again, slightly different. This will also use some backpedaling. I won't go into this, but just another example of one. There's a video down there if you'd like to see it in action. And lastly, I want to leave you with, in terms of training tools, two different options, so two different pieces of equipment that can help you train it for agility. One is the agility ball. These are so much fun. That's a little yellow ball you see on the right side of the screen. So because it's very bulbous, when you drop it, you don't know where it's going to go. So this is one idea of an open drill, of course. So you have to pay attention to, tracking this ball. You have to then figure out your footwork very quickly, and you have to react quickly, because the idea is that you get in the ready position, and I'll show you guys this next class, but it's essentially something that we kind of did when we were practicing the Olympic lifts. So the ready position is where you shift your weight to the balls of your feet, you bend your knees slightly and your hips slightly, and you have your arms out and ready, so out in front of you and slightly out to your sides. So this is the ready position that's used in all athletics pretty much. So you stand there, either you or somebody else drops the ball, and you have to pick it up before it touches the ground again. Okay, so there's open movements here. It's complex. There's a lot of tracking and maneuvering that needs to happen. Another option is the agility ladder, as you see down on the right-hand side. This is very good for teaching foot speed, so it's really actually pretty common in football especially. There's a lot of different variations of using this tool, so it can be used for foot speed, movement mechanics. They're trying to move in and out of this ladder on the ground as much as possible, and again, there's many different variations of how this can be used. Okay, so that's all I have here. There's another video down at the bottom that looks at another really open drill of a football player using a partner, and it's very open in that the coach has not told them exactly where they're going to be moving, so they have to pay attention to the coach as well. So just some examples of sport-specific agility training. So that's all we have today. Again, I'm sorry about the snow day. I know it's difficult to do a lecture, especially like this via video, but please come to class with any questions, and I will see you on Thursday.